This episode of Distraction is sponsored by Landmark College. Try their free comparison tool for colleges with learning disability support at lcdistraction.org. Landmark College. Learn your way. Succeed uniquely. Hello, this is Dr. Ned Hallowell for Distraction. We have a mini episode right now on diagnosing ADHD. How do you know if you have it? Contrary to popular belief, there is no definitive test. So, how do you know if you have it? Well, the history is the key. Your story, your recollection of your life. You need to sit down with a trained professional, someone who knows the telltale signs. So you need to sit down with that person and relate your story and hopefully sit down with another person, because we people with ADHD are not good self-observers. So you want to tell your story and have your story also related by someone else who knows you well, be it a parent, a spouse, a teacher, a sibling, partner, whatever. So the history is solicited from or elicited from two sources. And then you follow logical steps toward diagnosis. You seek help. Most adults who have ADHD do not suspect they have it. They just feel that something is amiss. Most or many are being treated for some other condition, not ADHD. Maybe it's depression. Maybe it's anxiety. Maybe it's substance abuse. Maybe it's post-traumatic stress disorder, something other than ADHD. Review your history. Find a physician knowledgeable in the field. Again, find somebody who has experience in dealing with this. Go over your life story. And as I said, it's best if two people relate the story. Talk about a variety of areas: family history, birth history, school, home, and job history. The key tip-off is unexplained underachievement. You're not doing as well as your talent would warrant you should be doing. And consider all the possible diagnoses. Many things can lead to what looks like ADHD, maybe an anxiety disorder, maybe depression, maybe substance abuse, maybe history of trauma, maybe hyperthyroidism, maybe some other medical condition. So you want to make sure the doctor you're seeing considers the full array of possibilities before you just jump to ADHD as the diagnosis. And that's why it's so important to see a doctor who understands the full array of possibilities. But unexplained underachievement is usually the lead, what we call chief complaint in terms of tipping you off. Then once you've taken the careful history, once you've gone through what we call the differential diagnosis, the various possibilities, and you've decided that there's a pretty good chance that this is ADHD, you proceed with psychological testing, what we call neuropsychological testing, because it combines the neurological aspects with the psychological aspects. Now, this is not definitive, but it's very helpful because it uncovers parts of the diagnostic workup that the history can't self-report. Processing speed, working memory, other indices of memory that an individual can't self-report. So the results of the neuropsychological testing combined with the history lead to the diagnosis or not diagnosis of ADHD. And once you have that, then you proceed with planning as to how to intervene. And the intervention, should be multimodal, including, of course, education, exercise, nutrition, meditation, heavy doses of human contact, what I call the other vitamin C, structure, coaching, and medication, which can help about 80% of the time. Doesn't always help, but 80% is a pretty good batting average. Okay, this is Dr. Ned Hallowell with a mini episode on how to diagnose ADHD. Thanks for joining us. Please rate and review Distraction on Apple Podcasts. Please take a moment and go there now while you're thinking about it. Rate the show and leave us a review. We truly appreciate your help in making the podcast a success. And a very special thank you to those listeners who've left us a review in recent weeks. Thank you so much. And remember to reach out with your questions, comments, and show ideas. We love getting your emails and voicemails. Our email address is connect@distractionpodcast.com, and our phone number is 844-55-CONNECT. That's 844-55-CONNECT. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people. Our producer is the delightful Sarah Gurton. Our sound engineer is the young genius Scott Person. And our original music theme was created by the mysterious Mark Berman.